There's a lot of data and studies on the types of people that are doing these mass violence, committing these mass shootings. And a lot of the data shows that less than 10% of shootings nationwide involve a suspect with a mental illness. And of course, we've heard a little bit of mixed messaging with the Uvalde shooter, and won't get a lot of those answers now because he was killed by officers there. So Andrea, given this data, do you think that mental health should be the primary focus as a solution?
I don't think, I think we do need more mental health resources in this country and in this state, but I don't think it's going to be the solutions to prevent gun violence. 1 in 5 people in this country have a mental illness. Most of those people are not violent people and do not commit these acts. The problem is when somebody that has a mental illness or has suicidal intent or intent to harm others has easy access to a firearm, that's when these things happen. So we have many things that we can do. I have a list of policies that we can put in place that would have better assurances of those people who we are giving access to these firearms on the front end. They don't at all take away rights for law-abiding citizens. I respectfully disagree about the comparison to prohibition. Gun owners have a lot of rights in this country. A lot of rights in this country, and any law-abiding citizen that wants a gun can go in a store, get a background check, and get a gun. So I don't think law-abiding citizens' rights are being curtailed by any means in this country. Quite the opposite. In Texas, they're getting more and more rights every session, as opposed to public safety measures, which get shot down every session. So I do think we need to look at mental health, but at the end of the day, if we don't look at who has access to these firearms and make sure we're more careful about who has access, these things are just going to keep happening.
Edwin, I want to go to you. Do you see mental health as being a common denominator in a lot of these cases?
Well, there's obviously the issue of mental health, but whenever you're dealing with the criminal law, obviously there are individuals out there that just have this evil intent. I mean, they're just simply morally bankrupt, soulless individuals who want to commit these crimes. And so I think a lot of people, before they start talking about this, they need to explore the Texas Penal Code and see what crimes already exist that cover these circumstances. I mean, the Texas Penal Code is a very large code. It contains crimes against harassment, against terroristic threats, against deadly conduct, disorderly conduct. It covers crimes with recklessly discharging a firearm in a city of over 100,000 people. It covers crimes where people may see somebody carrying a gun, and the reasonable person will be alarmed by seeing such a person. The Texas Family Code also contains provisions that can be applicable to certain situations where family members believe that they have a family member that is either suffering under some delusional episode or is in fact in immediate danger to themselves. There's a provision, I know that we hear a lot about, people say red flag laws, people support red flag laws. Texas has a red flag law. It's Texas Health and Safety Code, Chapter 573. It exists. It's existed for 25 years. It allows the police, who they believe are encountering an individual who's having a mental episode, to arrest without a warrant, to take them into custody, to confiscate all the firearms that they're in possession of. So the laws exist. They need to be enforceable. I think the legislature has gone a little bit in increasing the penalties. Last legislative session, they increased the penalty for a felon who is caught in possession of a firearm. They increased the penalty for an individual who doesn't engage in safe storage, and the child accesses the firearm and injures another person. So pretty much everything that we're talking about, there is already either a crime that covers it or it has a very severe punishment. For example, killing children, capital crime. Killing more than one individual in a single episode, capital crime. Carrying into a school and killing somebody, that's a felony to carry. Felony murder rule, capital crime. So you already have these crimes, you have the punishment set out, and I think it's an issue of enforcement.
Okay, interesting point. Andrew, did you have something to say?
Yeah, I was going to say, I work very closely. I work very closely with law enforcement, and they do not believe that they have the tools that they need to enforce the laws on the book. We may have what you had referred to in the code, but something that warrants an arrest, some people may need their guns temporarily removed, but they may not need to be arrested. So we don't have a true red flag law in this state. We don't have a straw purchase law in Texas. We don't have a prohibition against people who have been adjudicated as mentally ill or put in a mental institution. There's lots of gaps in our laws in Texas. And if you go to law enforcement, and it's unfortunate that we don't have law enforcement here today, they will tell you there's a lot more we can do in Texas to keep all Texans safe.
Yeah, I just want to say thank you. One of the things we need to be concerned with is the rights of the individual who's in question here. And a lot of the stuff that Edwin mentioned requires a criminal charge, which then has a criminal record. And we need measures short of that in case we find out it's just some kid doing stupid stuff on his computer. So forcing him into the mental health system and a possible commitment or assignment of mental health, or forcing him into a criminal charge, which says on his record, is not
All right.
necessarily the best thing.
Sorry to cut you off. We will be right back. We have to go to break.